The COVID pandemic continues. Here in Ontario and Canada, the third wave is well underway. Everyone is starting to be more and more worried, to be concerned. We're talking about stressed out, overwhelmed, fear for the future. It's time to talk about mental health first aid. I'm Dr. David Murphy. I'm a physician. I'm a psychotherapist. I'm based in Leamington in Ontario in Canada, and I'm a mental health first aid trainer. I think now more than ever, mental health first aid is necessary because many people are feeling stressed. They're having mental health problems. Particularly our frontline workers are getting overwhelmed by the work that they're doing and the stresses they're facing. So what is mental health first aid? It's similar to physical first aid in that it's the help that's provided either until medical treatment can be obtained or until appropriate support is found until the crisis is resolved. And the mental health first aid program teaches members of the public how to help a person who is experiencing a decline in mental well-being, or is experiencing a worsening of an existing mental health problem, or is experiencing a mental health crisis. So what is well-being? When we have well-being, life is good, life is going well. We have energy, we're going to work, we're involved in our relationships, we're participating in social activities and recreational activities. And when life's lumps and bumps come along, as it always does, those bumps in the road, we manage them, we can cope with them. We're resilient to those events. And we move on through them, we move around them, life goes on. When well-being declines, we might start to have a mental health problem. And in this situation, we're starting to have difficulty coping with those bumps in the road, or just coping with life in general. We start to perhaps need a stress day off. We might be having difficulties in our relationships at home or at work, might be irritable or annoyed easily. And we might be perhaps drinking a little more or using a bit more cannabis. And it starts to be a problem. And when our well-being declines even further, now that problem deteriorates into a mental illness. And now we probably have a diagnosis. And it's at that time that we'll almost certainly need some form of professional help to get us back into a sense of well-being. When we have a mental health problem, we might just need the help of friends or family or co-workers. And if a mental illness declines even more, our well-being declines even more, now we might have a mental health crisis. And in this situation, we definitely need professional support, and we need it urgently, within 24, 48 hours, or even immediately. And why is mental health first aid needed for these situations? Well, mental health affects all ages, genders, cultures, careers, social status. Substance use, for instance, affects about 20% of the population, regardless of your educational background, regardless of the job that you do, it affects everybody. And in the coming 12 months, as many as 500,000 Canadians will miss work each week because of mental health problems, and 1 in 5 Canadians will experience a mental health problem or a substance use problem in the coming 12 months. Mental health problems and illness account for 30% of disability claims. Almost a third of disability claims involve a mental health problem, mental illness. At the same time, though, mental health issues account for 70% of the cost of disability claims. So mental health disability is expensive. And yet only 34% of employees report having ready access in their workplace to mental health services. These statistics come from the Mental Health Commission of Canada. So why is mental health first aid needed? Because professional help may not be immediately available. We don't have paramedics and trauma surgeons standing on every street corner just in case an accident comes along. We don't have psychiatrists, psychologists, social workers out in the community looking for people who might be finding difficulty managing their lives. And then there is a social stigma associated with mental health issues. People are reluctant to talk, so we need people with mental health first aid expertise who can engage them in a conversation about what is happening in their lives. Members of the public may not have the skills or confidence to help, and yet mental health first aiders will have the skills and the confidence to help in a mental health situation. The person themselves who's struggling with their well-being may be unaware of the problem or the possible solutions. particularly if someone has an alcohol problem or is smoking too much cannabis, they might be unaware that their drinking and their smoking cannabis is having a problem for them in their lives. A mental health first aider will know how to help a person recognize that they have a problem by initiating a conversation about the problem. A first aider will be capable of de-escalating a situation such as a mental health crisis, and will know what help is available in their own community so that the person in distress can be connected to those supports. So what are the MHFA actions? Physical first aid has its actions: ABC, airway, breathing, circulation. MHFA actions are also an acronym: A, L, G, 2 E's, and an S. Now, it's perhaps not a catchy acronym that might stick in your mind, but perhaps to put this in context, mental health first aid was developed first in Australia. I understand that Algernon is a common first name in Australia, and Algie is a short form for that. So it's like Bill is for William or Mo for Mohammed, and Algie is an Algernon. So think of Algies as a group of Australian Algernons. And what do those letters stand for? A, we want a mental health first aid will approach, recognize someone is in distress, will approach, assess the situation, and offer assistance. We'll listen without judgment. We do know that when we have a mental health issue, when we have an emotional problem, talking about it helps. And we need someone to listen, and we need to have someone listen without judging us. We want that same person to give us reassurance and to give us hope that there are solutions, there is help out there. In mental health first aid, the 2 E's are both encourage. In certain situations, we might encourage professional support, maybe a family doctor, a social worker, a psychiatrist, a psychologist, a psychotherapist. In other mental health situations, it might be that family, friends, co-workers can offer supports, and that will help to solve the problems. And S has been added more recently as the online program has been developed, which only was initiated last fall, in the fall of 2020. And now we talk about self-care for the first aider. It's important to recognize that we can't help someone until we've helped ourselves. And also it's important as a first aider to be a good role model for self-care, for taking care of ourselves. A mental health first aider will be able to recognize the signs and symptoms of a mental health problem or a mental health crisis. A mental health first aider will initiate a conversation with someone who is in distress, and will use a collaborative approach for helping that individual access the support that they need. We know that early intervention can prevent a decline in well-being, and can prevent that decline in well-being deteriorating into a mental health problem, and can prevent that mental health problem deteriorating into an illness, and prevent that mental illness from deteriorating into a mental health crisis. And early intervention can also promote well-being and recovery. Mental health first aid training teaches participants how to apply MHFA actions to a decline in well-being that's associated with depression, with anxiety, with substance use, with psychosis, with gambling problems and eating problems. And also how to apply MHFA actions to a mental health crisis that might be associated with suicidal thoughts and behaviors, or non-suicidal self-injury, self-harm, panic attacks, the immediate consequences of a psychologically traumatic event, and to situations where an individual has a severe psychotic state. Here are the top 5 reasons for investing in staff mental health, mental well-being. We know that if we have mental well-being, we're going to be productive. And so improving staff mental health will improve productivity in the workplace, and it will reduce sick days. If we have well-being, we're not going to need sick days. And of course, improved productivity, reduced sick days, reduces costs to the workplace. There will be a reduction in staff turnover. If your staff is feeling well, they're not going to be leaving your workplace to search for greener pastures. And then there's improved customer satisfaction. If everyone in the workplace is feeling satisfied and has well-being, then the customer is likely to be more satisfied too, less customer complaints. This information is from Mental Health First Aid USA about wellness in the workplace. How do we create a wellness attitude in the workplace? We need to create a foundation of trust. A trust between co-workers, between management and staff. They need to feel they can have trust that they can share their concerns and share their mental illness or their decline in well-being with someone in the workplace and not be stigmatized. So we need to reduce the stigma. It's important when someone discloses, they're not judged, they're not criticized, they're not ridiculed. We want to make workplace well-being a priority. We have health and safety committees in a lot of workplaces for physical safety. We also need to do this for mental health well-being as well. And that definitely involves mental health first aid training. There have been some studies carried out in workplaces where when mental health first aid training is being given to people in the workplace, then sick days go down and productivity goes up. The online training, which as I mentioned is initiated just last fall, is in 3 modules. The first module is a self-learning activity. And so participants carry out this workshop on their own, this module on their own, accessing it online. It takes about 2 hours. It's an introduction to mental health first aid, an introduction to the mental health first aid actions, to ALGES, and it's an introduction to the role of the mental health first aider. At the end of module 1, a participant takes an online test. There's no pass mark. It's a way of making sure that you have actually completed module 1 before you can join modules 2 and 3. Modules 2 and 3 are live training online. They can be done separately, those 2 modules. The second module must be put online within a month of the first. I prefer to do them both on the same day. Module 2 is 3 hours. It's an online webinar. It's interactive and it's experiential. We review module 1, the topics in module 1, and then we practice in breakout rooms applying MHFA actions to a decline in well-being. And in this workshop, we focus on a decline in well-being that is presenting as depression or anxiety or as substance use. We talk about conversations with diverse cultures. Canada is a multicultural society. I'm from another country. I speak a different dialect of English. And it's important to know how to have conversations with diverse cultures who might be having struggles in their lives and have a decline in well-being. And it's important to perhaps know also how to talk to someone whose first language may not be English or French. And it's also important to know how to have conversations with members of the Two-Spirit LGBTQ+ communities. Module 3 is also 3 hours, an online webinar, also interactive and experiential. We review module 2, and then we talk about self-care for the first aider. It's a really important topic. I'm so pleased to see we've included it now in the online training. And then we practice applying MHFA actions to a mental health crisis, in particular to situations involving suicidal thoughts, a panic attack, and severe substance use, basically intoxication with alcohol or drugs. And then we learn how to de-escalate a situation where an individual is agitated or angry. When the course is completed, participants are certified in mental health first aid by the Mental Health Commission of Canada. So our new mental health first aiders are capable of recognizing the signs and symptoms of a decline in well-being. They now have the confidence to support colleagues, friends, neighbors, family, even strangers who are dealing with troubles with their mental health. Each participant is provided with a detailed participant's manual for continued learning, and also some workplaces do actually provide a continuing professional development credits for completing the course and being certified in mental health first aid. Here's a summary of the 3 modules of the Mental Health First Aid Virtual Classroom. If you found this presentation helpful, please hit the like button down below. and subscribe to the channel so you can be notified of any new videos I post either on mental health first aid or other topics on mental wellness and well-being that I post from time to time. If you're interested in mental health first aid training, either as an individual or your workplace, I put some information in the comment section down below that will help you find mental health training with myself or with more information about mental health first aid. I'm Dr. David Murphy. Stay well, stay healthy. Goodbye for now.